Bolivia, a country rich in cultural diversity and breathtaking landscapes, is embarking on a transformative journey in healthcare that promises to change lives. At the heart of this change is a deep commitment to empowering its indigenous communities, who have long been the backbone of the nation's cultural heritage. For too long, these communities have faced significant barriers in accessing quality healthcare, often due to geographical isolation and economic challenges. Now, Bolivia is leading the way with innovative policies and programs designed to address these disparities head-on. These initiatives aim to bridge the gap and ensure that everyone, regardless of their background or location, has an equal opportunity for a healthy life. This is not just about providing medicine, it's about creating a holistic approach to health. It's about recognizing and respecting the traditions and values of indigenous peoples, integrating their wisdom with modern medical practices. Bolivia's approach is unique and inspiring, setting a precedent for other nations to follow. It recognizes that true health equity can only be achieved by listening to the voices of the communities themselves, ensuring their needs and perspectives are at the forefront. This means understanding their unique challenges, which often include a lack of infrastructure and resources, respecting their traditional healing practices, which have been passed down through generations, and working together to find solutions that are culturally sensitive and effective, blending the best of both worlds. The world is watching as Bolivia paves the way for a more just and equitable healthcare system for all, demonstrating that when communities are empowered, true progress is possible. The geographical diversity of Bolivia, from the towering Andes Mountains to the lush Amazon rainforest, poses unique challenges for healthcare delivery. The vast distances and varied landscapes make it difficult to establish a consistent healthcare infrastructure. For indigenous communities living in remote areas, access to basic healthcare services can be incredibly difficult. These communities often have to travel long distances, sometimes on foot, to reach the nearest healthcare facility. Distance, terrain, and a lack of infrastructure often mean that even routine checkups are a major undertaking. Healthcare workers face significant challenges as they navigate rugged landscapes to provide care. But the challenges go beyond geography. The healthcare system must also address the unique cultural needs of these communities. Cultural barriers, language differences, and a historical mistrust of the formal healthcare system can also prevent indigenous communities from seeking the care they need. Many indigenous people speak native languages and may not understand Spanish, the primary language used in healthcare settings. Many indigenous communities rely heavily on their own traditional medicine systems, which are deeply rooted in their culture and beliefs. These traditional practices are not just medical treatments, but are also tied to their spiritual and cultural identity, making the integration of modern healthcare a complex issue. At the forefront of this healthcare revolution is Bolivia's Ministry of Health and Sports. This institution has been pivotal in driving forward initiatives that aim to transform the healthcare landscape of the nation. The ministry has made it a priority to develop policies that are specifically designed to address the needs of indigenous communities. These policies are crafted with a deep understanding of the unique challenges faced by these communities, ensuring that their voices are heard and their needs are met. One of the key pillars of this approach is the Family and Community Intercultural Health Policy. This policy is not just a document, but a comprehensive framework that guides the delivery of healthcare services in a way that is respectful and inclusive of indigenous traditions and practices. This policy recognizes the importance of integrating traditional medicine with modern healthcare practices. It acknowledges that traditional medicine has been a cornerstone of indigenous health for generations and seeks to harmonize it with contemporary medical advancements. This is not about replacing one with the other, but rather about creating a system that respects and values both. The goal is to build a healthcare system where traditional healers and modern doctors can work side by side, learning from each other and providing the best possible care to patients. The ministry understands that for many indigenous communities, traditional medicine is more than just a way to treat illness. It's an integral part of their cultural identity. It is deeply intertwined with their way of life, their beliefs, and their history. By incorporating traditional medicine into the formal healthcare system, Bolivia is taking a major step towards creating a more inclusive and culturally sensitive healthcare system. This initiative not only improves health outcomes, but also fosters a sense of respect and understanding between different cultural practices, paving the way for a more harmonious and unified society.